Hey everyone, I'm so excited. I'm here today with Dr. Jasmine Sawhne, board certified psychiatrist, and we are going to talk today to her about all of her work and the great things that she does. Hey Jasmine, how are you doing?
I'm doing well, Sally. How are you?
I'm good. Thank you for asking. Tell us a little bit about how you got into this work.
Sure, sure. Well, thank you first of all for having me on here. I'm very excited. I am, like you mentioned, a board certified psychiatrist. I had my journey through medical school, decided to practice psychiatry. I currently have my own private practice, and I do have a particularly special interest in maternal mental health. So I think just, kind of seeing patients throughout my journey. I think I was just drawn to this particular niche. I think it's important to kind of recognize when women need additional support, and how they're often a very neglected population. And I think that just kind of like drove me to like dig a little bit deeper and to kind of specialize in that.
I love that. And so, as a psychiatrist, you actually work with medicines. You prescribe, you manage medications for people. Can you
Correct.
talk a little bit about how you work with medications specifically through pregnancy? I know a lot of people probably are not sure if they can continue their medications, or maybe they need to start medications in pregnancy. Is that safe? Do you work with people, and how does that look?
Yeah, so that's pretty much what I do on a daily basis. I think that this is an important topic. It's often surrounded by a lot of fear or confusion or misinformation, and that is really the use of antidepressants or particularly SSRIs during pregnancy and even in the postpartum period and beyond. So what I hear often is, you can't take an antidepressant during pregnancy because it's dangerous for the baby. Or I'll hear postpartum depression just goes away on its own, like if I just wait it out. Or if I take a medication while I'm breastfeeding, it's going to harm the baby's like brain development. And these are understandable fears. We don't want to mitigate these fears, but we want to protect our children, but they're really not based in what is the current research or the clinical experience that I've had treating these. So if we want to talk about facts, and obviously we're using high quality studies, we're using clinical guidelines. Untreated psychiatric illness in pregnancy is far more harmful than actually being on a medication. So, when we're talking about depression or anxiety or OCD or PTSD, that can lead to poor prenatal care, could lead to preterm birth, even suicidal thoughts or acting on thoughts into attempts, or even an increased use of substance use to help manage those symptoms in other unhealthy ways. And SSRIs are the most common antidepressants, and I'm sure like many of the listeners have heard of like Zoloft, Prozac, Lexapro. These are the ones that have been around for a very, very long time. Medications like that, they have decades of safety data, right? So for most people, the risks of staying on them is lower than actually stopping the medication. So sometimes I'll have people that are completely medication naive. They've never been on medications, but they are really struggling through the pregnancy, or this is now post delivery and they're experiencing postpartum depression. We're having conversations around what are the symptoms that we're looking to treat. Extreme level of depression comes with not only just your mood, it affects your sleep, it affects your appetite, it affects your ability to concentrate and to be able to make logical decisions. Safety concerns around the baby can come up at that time. It affects your energy levels. We can see suicidal thoughts of harming self. We can see thoughts of I'm not able to care for this baby because I'm just not in that correct headspace, and thoughts of harm for the baby can occur as well. And these are very serious and dangerous concerns and definitely treatable. So if we don't treat these, they can escalate. And if they are treatable and even preventable, we can see obviously better outcomes. Um, and I think a lot of people struggle with risks or side effects associated with medications. And so, for instance, just major birth defects in the general population, the risk of having a birth defect is, I think, between like 3 to 5%. When you add in an SSRI, that risk can go up slightly by maybe 1%. So really, that's not a reason to avoid treatment if it's needed. Because if you think about long-term maternal mental health and baby's outcome and development, a slightly 1% increased risk in the general population versus those long-term risks that we can see in the mom or the baby are just so much more significant. So mental health symptoms, they're pretty common. We often talk about postpartum blues. But when that 4 week period postpartum ends and there are lingering symptoms and now they're affecting the functioning of the mom and or ability to care for baby, that's something that we want to like examine and take a closer look at. And so like 1 in 5 women will have some sort of mood disorder during or after pregnancy. That number's higher, women of color, women with fewer social supports. Um, and then the other conversation I have is, are these medications safe for breastfeeding moms? And for instance, Zoloft, like I mentioned, minimal transfer into breast milk, and that's considered like a first line treatment even when you're lactating. So we have options, and we want to educate people that there are options, right? We don't want people to feel like they're just drowning and there's no one's throwing them a lifeline.
It sounds like this really is more of just a complete wellness for people rather than I think there's a stigma out there of medication. And I like that you're using the term medication naive. And I think a lot of people have misinformation about what it means to be on medication. And like you're saying, like postpartum depression is just going to go away. Like we all know that's not true. Like, that's not how it works. You definitely need all the support you can get during postpartum. Could you tell us, for anybody who's out there who maybe is postpartum and having some symptoms, what are some symptoms that you should look for? Like what are the key indicators that you need to go speak to someone?
Right. So what I see quite often are these daily crying spells, right? So for no like specific trigger, you're seeing yourself having these just, you're breaking down and obviously crying and having these moments of like you're just collapsing. The world is kind of like weighing down on your shoulders. You're not sure what to do. You're like drowning and you're not able to kind of just pull yourself out of it. And then, like I mentioned, your ability to concentrate or make like effective decisions. It often can be something just like, am I supposed to, the baby's crying. Do I change the diaper first or do I grab the bottle first? Like, but your mind is just so confused because there's no clarity because the depression or the anxiety is so prevalent that you're just not able to even kind of like make that like quick executive decision, which affects, right? Like your day to day. Like think about doing that on repeat throughout the day, 24 hours a day. And you're already sleep deprived because obviously you're in this moment and the baby needs, to be fed every 3 to 4 hours. So there's already a lack of sleep, which can exacerbate these symptoms. But then when you're not able to make these decisions and you feel like you're just swimming in options of what to do, it's hard to pull yourself out of that. Oftentimes, I see family members recognizing symptoms before moms are recognizing symptoms because they'll be like, you're overly anxious, like you're not able to hand the baby over, you're not able to like leave to take a shower, you're not able to do like your day-to-day tasks because you're so worried something's going to happen to the baby, or you're putting the baby down to sleep. You can't even take a nap at that time because you're worried, like, oh, is the baby going to stop breathing? And these are common fears every mom experiences. But like I mentioned, there's a difference between that like initial 4 week period where you're learning a curve of being a mom versus now you're 6, 7 months postpartum and you still haven't been able to let go of these fears. You're still not able to feel comfortable and relaxed into this new role. So that's what we consider to be like more severe postpartum anxiety. And I think you bring up a really great point because like mom's mental health is really a public health issue. I mean, we don't have good supports in place at all for women, whether that's being able to have like time off of work, whether that's breastfeeding support. I mean, we're just as a country, we don't have these anchors in place for moms. So now, if we're having untreated mood and anxiety disorders, that is going to create even more detrimental effects. So that can affect bonding with like infants. It can affect like the emotional regulation of a baby. It can affect the child's long-term development. So when we're treating the mom, we're also protecting the baby. And like when they say, put your own oxygen mask on in the plane before you help others, right? Like you can't help a baby if you're grasping for air yourself. And so we know like these early interventions through the pregnancy, immediately screening, immediately postpartum, that can have better long-term outcomes, for the mom, for the baby, even future pregnancies. You're protecting your body and your mental health so that your long-term outcomes are significantly easier.
I think that's so important. You said a couple of things that I really love, and it's true. Like you have to take care of yourself so that you can take care of someone else. And I think that during pregnancy and postpartum, a lot of times people won't focus on taking care of themselves. But if you frame it in a way that like you're actually taking better care of your baby in this way, that's a little bit easier to understand. And also, I really like that you said someone else needs to see it. So this is actually good information for any partner or any family members or even, a postpartum doula or a night nurse or anybody who's around to be able to catch those signs to help someone. I think it's important. My background is a prenatal and postpartum massage therapist, and I would always say once people were getting close to their due date, I would say to the partner, listen, like these are the signs that she's going to need a massage. Like call me, you call me. Like I would give my information to the
Right.
partner because she's not going to know what's happening.
Exactly.
Like someone
Exactly.
else needs to walk in.
That just goes back to that like executive decision making piece, right? Like, because if you yourself can't recognize those things that you need to do on a daily basis, like you can't even put the baby down to take a shower and take a moment for yourself to have a meal or, take even 5 minutes of self-care. And I'm not saying taking a shower or eating is self-care, but just moments to yourself. If you can't recognize that you need to do that, there's no way you're going to be like, I need to call and pick up the phone to call my OB. Or to
Right.
call my primary care doctor, or how do I even approach getting a referral to a psychiatrist? How do I even begin to talk to a therapist? Like that's just so far down on your list of things that you need to even be thinking about. And I think people are scared for good reasons. I mean, there's sensational headlines. There's family members that are telling you, oh, just tough it out. This is normal. You don't need this. They feel, even providers. Like I think people are feeling like they're not being heard by their providers. You have maybe 20 something visits with your OB when you're pregnant. You have one postpartum visit. And if you're not saying the right things during that first 5, 6 week postpartum visit where you're saying, I'm feeling depressed or anxious, you're not getting a follow-up visit.
Right.
So we just don't have those measures in place to recognize where someone is slipping. And like I mentioned, the earlier you intervene, the better the outcomes are. The longer breastfeeding times are associated with treated mood and anxiety disorders, right? So if you're already struggling with a latch or you're overwhelmed pumping all day long, and then you have untreated depression and anxiety going in with that, you're not as likely to continue that breastfeeding journey. So I mean, there's immeasurable outcomes.
Absolutely. Absolutely. I think it's so important. Could you give us a little bit? We've heard you don't see it a lot, but you do. We're talking about sensationalized headlines. There is like postpartum psychosis as
Yes.
well. Could you talk a little bit about what that is and what that looks like?
Yes, so interesting. Actually, I was just speaking to a reporter about this. So there'll be an article that I am going to be quoted in recently. It's coming out soon. It's rare, but it's a very severe psychiatric emergency. It often develops like days to weeks following childbirth. And when I say rare, it's about like one in every like 1,000 births. But it's rapid mood shifting. There's delusional thoughts, like a lot of paranoia. There could be dangerous hallucinations. So, command auditory hallucinations is a technical term, but it's hearing a voice commanding you to harm the baby. Just very disorganized thinking. There's impaired judgment, and it has a sudden onset. So it's not like it's different from postpartum depression and anxiety, where you kind of like have this like heavy fog like sitting on you, and that's just escalating days and weeks and weeks and weeks. This is more acute. It's like it kind of develops overnight where you're starting to hear voices, or you're starting to feel this extreme level of paranoia, like even like your partner is trying to harm the baby. Your mother is trying to, is at the house and trying to harm the baby. Like they're very severe, sudden thoughts. Um, that's probably the highest risk to mom and baby because we have had reports of and cases where the hallucinations are so strong, mom can often act on them and actually physically harm. So you need to be able to hospitalize mom in those very, very severe cases. And then the medication treatment of choice is actually not like a common antidepressant. We would have to use antipsychotics because the receptors of the brain that are activated during that time in depression and anxiety, we primarily work with serotonin. And so when we talk about SSRIs, we're boosting serotonin in the brain. Depression and anxiety come down. When we have psychosis, it's actually the dopamine receptors of the brain. So you need a blockade there. And that's what will completely resolve these hallucinations or these delusional thoughts. Again, very treatable. If you recognize it right away and you get it and an antipsychotic on board, these symptoms can be treated in 1 to 2 weeks and they'll never come back again.
That's amazing.
But
That's
if you miss the mark, right? Like if mom is extremely paranoid and no one around her is recognizing that this is now like a more delusional fixed belief rather than just mom anxiety. If you miss the mark, yeah, it can be very, very dangerous. So that's a very, very severe and rare mental health condition.
yeah. Thank you for clarifying that because I feel like that's something that's not often talked about, but it is important to know. So I think we've covered everything from pregnancy through breastfeeding all the way into anxiety, depression, psychosis, who to contact, how to treat these issues and that they're safe. Thank you so much for talking to us today. Could you let people know where you are, where you practice? Are you in
Yes.
person? Are you virtual?
I am fully virtual. I practice throughout the state of California as well as in New York, so I am bi-coastal. The best way to reach me is through my website, so that's just www.jasminesawhne, SAWHNE.com. There's kind of like an interest form there. What I offer is always just like a phone screening to be able to understand your needs, exactly where you are right now in your mental health journey. I'll do a little bit about like what I think could be beneficial, and then we would kind of schedule like a longer evaluation from there. I am like very cognizant and mindful about the use of medication. So my goal is to have someone on the most minimal amount, obviously creating some sort of effective use and minimizing any sort of side effects. So I really am not in one of those boats where like we need high dosages of medications and then we're creating another problem with a side effect. I think that's poor practice. So I really try to like minimize the use of medications, but when it is a helpful tool, we want to have that conversation.
That's great. So if anyone feels like they're having some symptoms and they're not sure, they can get a 15-minute consultation with you.
Yeah, exactly, exactly. And there are other helpful tools like psychotherapy, and so like CBT, for instance, is very effective. And then peer support groups and things like that. But if there is a role for medications, we'll kind of go through the ins and outs of it, and like if you're the right fit or right candidate, then yeah, we would have that conversation.
I love that. That's amazing. Thank you so much for speaking with me today. I learned a lot, which I always learn from talking to every provider, and you're so informative. And we will have your website and your information in the description here. So thank you so much. I really appreciate you taking the time to speak to me today.
Thanks for having me.
So good to talk to you.